Having children is becoming more dangerous for women in this country, especially in one specific population. First, let's look at how we compare overall to other developed countries around the world. This shows how many women died from pregnancy-related causes in 2020 in industrialized nations, so countries with industries and economies like ours. That makes it a fairly direct comparison. We all have modern hospitals. This is per 100,000 births. If you look right at the top, clearly the worst place is us, the United States, with 3 times the rate France saw that same year, and other countries even lower than that. That's also much worse than the previous 3 years in the US, especially for the group of people this bar represents over here. So for white women, the rate jumped from about 24 to 33. But for that group, it jumped from an already high 55 to about 70 deaths per 100,000 births. And that group is Black women. So why is that? Black women on average go into pregnancy with more comorbidities. Those are health issues that would make life or any medical condition more difficult. High blood pressure, diabetes, asthma, and other challenges. That's what Dr. Cheryl Wolf with Corewell Health explained to me. But there's something else, she said, contributes to the problem. It's not medical, it's not a condition, and it has nothing to do with cost.
Patients are just not heard. They're not listened to. So if someone says, I don't feel right, this doesn't look right, or someone asks a question, a lot of times it's just not heard. Oh, you'll be okay. Oh, that's just something that happens when you're pregnant. Oh, that happens after you deliver. Don't worry about it. And so it's really a call to action for us to listen to our patients.
By the way, that is regardless of education or income. It affects Black women from all backgrounds. So what are healthcare organizations doing to make it better? Well, Corewell Health has a few programs in place, including a free or low-cost doula program for any mom who wants one. Those doulas are people there to support women, especially during labor and delivery. They'll assign you someone who looks like you or has a similar background. Consider this a cheerleader or teammate. They'll push on your back if you're having back labor. They'll help your partner figure out how to best support you. They're in it for the long haul. And if a doula is focused on labor, another program takes you through the whole process and comes right to your doorstep. That one is called Healthier Communities. Let's listen to a supervisor in West Michigan describe how it works.
So we go out to visit moms who are pregnant up to baby is 18 months old to support, peer support, education, connect to resources, a lot of advocacy work. We talk a lot about how to be heard when you go to the doctors, asking more questions about, is this medically needed? Or is this something that, what is mom's hopes for our birth?
Let's pause now and look at what these women are dying from. We're talking about pregnancy-related causes here. And this is for all races. Hypertension is a big contributor, but that's not #1 overall. In fact, you may be surprised by this, but represented in this orange piece of the pie, yellow piece of the pie here is mental health. That is behind 23% of the deaths in women from pregnancy-related causes in this country. Suicide. And again, it is worse for Black women. Another program for pregnant women connects them with others who are at the same stage of pregnancy, which is important, creates this village. It's called Centering Pregnancy. It's a national program, but it is available in West Michigan. The women have one-on-one visits with their provider, and then they meet together as a group. The midwife who runs one of the groups said it has made a noticeable difference for her patients.
I think feelings of, isolation, depression, lacking that community engagement, those can really be addressed well in this setting. I can tell who has been in centering pregnancy without looking at their chart. They are more well-informed, they feel more comfortable asking questions and practicing shared decision-making with their healthcare provider.
So this shows outcomes for women who have gone through the program, and this is specifically for preterm births. Remember that gap we talked about between Black and white women? That existed for preterm births as well, but this program helped close the gap, nearly eliminating it when you compare it to overall Kent County for women who didn't go through the program. Now, Corewell Health has not been collecting data for mental health when it comes to maternal mortality, but Dr. Wolf, who we heard from first, says that is something they will start to track now that they know what an issue it is. As far as what this all means, though, even if you don't have children and you don't plan to, women dying as a result of pregnancy has a cost for all of us. You have children with no mothers, broken families, and these solutions we talked about cost very little by comparison. You'll be able to read about those online at woodtv.com.